this video we are going to see about the vital organ, that is kidney. So first we are going to see about the functions of it. So it mainly involves in the excretion process. So it is the main excretory organ, and it filters the blood and excrete the unwanted waste. So it also involves in the balance of the water and electrolyte in the body. So electrolytes such as potassium, sodium, all the electrolytes are balanced and maintained by the mechanism of the kidney. And coming to the location, as we know, there are pair of kidney, such as two kidneys are presented in the body. So it occupies hypochondrium. Right kidney occupies the right hypochondrium, left kidney occupies the left hypochondrium, and epigastric region and lumbar region. Some part of the kidney also extend to the epigastric and lumbar regions of the abdomen. So right kidney is lower than the left kidney because right kidney, above the right kidney, liver is presented. So because of the presence of the liver, the right kidney is somewhat lower, whereas left kidney is somewhat higher than the right kidney. Left kidney is somewhat higher than the right kidney. Okay. So as I said, location, first we have to speak about the abdominal region. Okay, so then we are going to speak about the ribs. So right kidney, as I said, somewhat right kidney is lower and left kidney is higher. So right kidney is related to the 12th rib, left kidney is related to the 11th and 12th ribs. So these are the location. Coming to the shape, it is bean shaped kidney. So external feature, so we have upper pole and the lower pole, posterior surface and anterior surface, lateral border and medial border. Medial, it's towards the hilum, lateral is away from the hilum. So we have two poles and two surface. So in hilum, so coming to the hilum, the blood vessels are passing through the hilum and reaches the kidney. So in hilum, the arrangement will be VAP, in the sense renal vein, renal artery and renal pelvis. So all these are arranged in this manner. So coming to the relations, as I said, when we speak about the relations, we have to speak about the peritoneal and visceral relations. Coming to the peritoneal relations, kidney is retroperitoneal organ, in the sense it does not present within the peritoneal cavity. And coming to the visceral relations, first we have to speak about the anterior relation and posterior relation. Coming to the anterior relation, we have anterior relations are different for the right and left kidneys, whereas posterior relations are same for the two kidneys. Okay. First we will see about the anterior relations of the right kidney. So in right kidney, we have right suprarenal gland area, where the kidney is attached to the suprarenal gland, and hepatic area. As we know, in the right side we have the liver. So hepatic area, the right lobe of the liver is attached to the kidney, and colic area. So this area where the iliac will be attached, and jejunal area, jejunum will be attached. In the duodenal part, duodenum, mainly second part of the duodenum is attached to the right kidney. So there are 1, 2, 3, 4 and 5 relations in the right kidney. The first is the right suprarenal gland, and coming to that, hepatic area. To that we have right lobe of the liver, and below that celiac area and jejunal area, and the near the hilum it is the duodenal area. That too, second part, right lobe of the liver. Okay. So these are the anterior relations of the right kidney. Coming to the anterior relations of the left kidney, we have left suprarenal gland. In left side we have a main organ, that is stomach. So gastric area, the stomach is closely related to the spleen. So splenic area, Spleen is related to the pancreas, so pancreatic areas. So all these three organs are or closely related, so all these areas are presented. Okay, so then jejunal area and celiac area, colic area. Okay, so in this colic area, left colic flexure is presented. Okay, so these are the anterior relations of the left kidney. Coming to the posterior relations, so as I said already, the posterior relations are same for the both the kidneys. So there are four muscles are presented: transverse abdominis, psoas major, quadratus lumborum, and diaphragm. So all these four muscles are related to the kidney. And three nerves: iliohypogastric nerve, ilioinguinal nerve, subcostal nerve. L1 and T12 is the subcostal nerve. And we have ribs. Already we discussed it here. So left kidney is related to two ribs, 11th and 12th. Right kidney only 12th rib because it is slightly lower. Okay. Coming to the capsule of the kidney, we have, see, this is the capsule. Okay, we have two capsule, that is true capsule and false capsule. False capsule is referred as the renal fascia. That green color is the false capsule. Okay, so first we have to see the layers of the capsule. First we have the false capsule, and between it perinephric fat, and we have true capsule, and we have paranephric fat. Okay, so first coming to the true capsule, it is closely related to the kidney. So in false capsule is also known as the fascia of carota. Okay, so perinephric fat and paranephric fat are presented around the kidneys. Okay, so here you can see the nerves which is related to the posterior relations of the kidney: iliohypogastric nerve, ilioinguinal nerve. Okay, the muscles also, the quadratus lumborum, all those muscles and nerves are presented. Posterior relations of the kidney. Okay, so coming to the macroscopic structure, what are the structure presented in the kidney? Okay, first is the minor calyx, major calyx, renal pelvis, renal brummets, medullary rays, and renal columns. So coming to the calyx, we have two calyx, minor and major. So minor is presented inward or inward the kidney, whereas major is somewhat lateral to the minor calyx. Okay, so renal pelvis, so from the major calyx, when we trace it out, we get the renal pelvis. And then renal brummets, which is usually presented in the medulla and extends to the cortex as the renal columns. So in medulla we have renal brummets, calyx, renal papillae. These are the three contents of the medulla in the kidney. Coming to the cortex, we have renal columns. Okay, microscopic structure, that is nephrons. Mainly nephrons is the structural and functional unit of the kidney, as we know already. So in medulla we have loop of Henle and collecting duct. Okay, in cortex we have renal corpuscle and PCT, proximal convoluted tubule, and DCT, distal convoluted tubule. These are all present in the cortex. And we are going to see about the arterial supply, that is arterial supply and the venous drainage. So coming to the arterial supply, renal arteries. Okay, so this renal artery give branch to the segmental artery, from segmental artery lobar artery changes into the interlobar artery. So all these artery, when the so renal artery enters the hilum of the kidney. Okay, actually renal artery enters the hilum of the kidney. After entering the kidney, this renal artery changes into the segmental artery and supplies some of the parts of the kidney. And this segmental artery changes into lobar artery, interlobar artery. From the interlobar artery, arcuate artery. From the arcuate artery, interlobular artery, and afferent artery, afferent arterioles, and finally forms the vasa recta. This vasa recta mainly supplies all over the surface of the kidney. This is the arterial supply. Coming to the venous supply, the vasa recta, joins to form the interlobar vein. See, vasa recta forms interlobar vein. Interlobar vein joins to form arcuate vein. Arcuate vein, interlobar vein. Interlobar vein, lobar vein. Lobar vein, segmental vein. Segmental vein, renal vein. Finally, it reaches the renal vein. So, this is what the blood is drained out from the kidney. So, it is easy. Renal arteries, renal vein. Segmental artery, segmental vein. Both the arteries and veins are corresponds to it. Okay. Coming to the lymphatic drainage, we have para-aortic nodes, which is referred as the lumbar nodes. So the kidney, mainly the lymphatics around the kidney, which mainly drains into the lumbar nodes. Coming to the nerve supply, we have both sympathetic and parasympathetic. As we know, parasympathetic is by the vagus nerve, whereas sympathetic is by the T10 to L1 spinal segments nerves, which arises from the T10 to L1 segment. So this is all about the kidney. To know about the clinical significance of the kidney, I will post a new video for it. Just wait for it. Thank you.